First thing we're going to do is we're going to talk about temperament a little bit. And we're going to talk about why kids have bad behavior, and then we're going to talk about the 3 types of temperament. That Chess and Thomas did all this research, and I'll tell you about that in a minute. Why do kids have bad behavior? Okay, and I will always say that there's no such thing as a bad kid. Okay, there are. I used to say that always, and then now I've come across some kids that are kind of bad kids, and I feel so bad about that. But I always try to look back and I say, well, where is it coming from? Okay, and I think inherently very few kids are actually bad kids, because you may have a kid who has a bad genetic predisposition. Maybe it's a father who's very aggressive or a mother who's very depressed, and they may get these genetics. But if you put it in a correct nurturing environment, those kids can still do very well. What happens is if you get some kid who has this inherited predisposition that I'm talking about at the top, and then all of a sudden you put them in where they're in foster care, 8 different homes, and they are abused, and they have all these other things, each of those is one more kind of notch that kind of will take them down to a level where it's a lot harder to get them and say, wow, I mean, because no kid wants to do bad when they're younger, okay? All kids want attention. They want good attention. Well, what happens if you can't get good attention? You need attention. You don't care how you get it. If you can't get it good, you get it bad. So then they start acting up and they get the bad attention. And our job is to kind of help them figure out, to see through some of that. So there's the inherited predisposition that we said, which is there, but we can actually adjust it a little bit and help the kids. Difficult temperaments, and we're going to talk about temperaments in a minute. And that's something I think that it's a real easy way to help you figure out when you walk in and you see a kid, in the first couple minutes, you're going to be able to tell what kind of a temperament they are. And by knowing their temperament, you're going to be able to adapt what you do to best fit that kid. So we can adapt to the kids as opposed to making the kids adapt to us. Activity level. And all these things right here are all different dimensions of the temperament that we're going to talk about in a minute. Activity level, high or low. Attention span, impulse control, and then you have the emotionality, just means how big of a roller coaster are they on, okay? And it's so funny when I talk about mood lability and with kids, and we talk about various things, we talk about being on a roller coaster, kids kind of look at me, and so then I say, okay, do you have a season pass to either SeaWorld or Six Flags? And they'll say yes. And so they say SeaWorld. They say, okay, when you're out there at the park, do you feel like you're on the steel eel, okay? Or do you feel like you're on that little bitty Shamu coaster? And sometimes the kids will be like, oh, I'm on the steel eel. And I say, okay, so when you're up, you're really up. And when you're down, you're really down. And they say, yeah, that's what it is. So whenever you're talking to the kids about these things, you want to put it into a realm where they can understand. So if I say your emotion is like a roller coaster, how big is your roller coaster? Then they can actually do that. And then what's fun, you can get a piece of paper and crayons where you're talking to the parent, and what they'll do sometimes is just draw me the roller coaster. What would be a normal person's roller coaster? What is your roller coaster? The comparison is always very helpful from them. If you compare one kid's roller coaster to another kid's, it means nothing. Okay? But if you compare one kid's roller coaster to their roller coaster the next visit and the next visit, then it'll make sense because you'll see how they're improving. And it gets them to understand what's going on in their head. They think about it as opposed to just acting on it. Sociability, how social are they? Response to stimulation. And that one is one of those, what happens if something occurs, okay? If they're a kid that, you just think of, taking them to a noisy restaurant and you think, oh, that's just going to be horrible, because that stimulation, they'll be way overstimulated. That is the response to stimulation. If it's very quiet and the kid can't handle it being too quiet, that's also a response to stimulation, but it's a response to lack of stimulation. Okay? So you kind of want to gauge that, and you'll start seeing things. And do they have regular habits? That's eating and sleeping. Okay. Is it somebody who stays awake all night and sleeps all day? Okay. So then what you do is you say, is that because of the parent's schedule? Or is it because the parents are like, please sleep at night, but the kid won't? Then what you're doing is you're having a little disrupted biological rhythms. Do they eat regular meals like most people do, or is it completely all over the place? And then physical characteristics and developmental abilities. So now we're going to go through these temperaments. So Chess and Thomas is a husband and wife, and they're in New York, and they did their research from 1967 through 1987. And if any of y'all have ever done research here before, what this was is they had, I think it was 150 families that they followed for 30 years. They followed these kids from when they were born, 30 years, and they had a 97% retention rate. That means they kept all these families in there. They knew what happened to these kids. They had those dimensions that we looked at on the slide before, and what they found out is they said everybody has one of 3 temperaments, okay? And at first when I heard this, I was like, I don't know about that. And then I started watching, and you realize it's very true. But you need to make sure that you don't say it's either this or this or this. You need to think of this as a spectrum, like the color spectrum. Okay, it goes from, you got black to white, and then there's all the colors in between. Well, what happens is with each of these, you may have the easygoing temperament, but you have the easy end of easygoing, you have the difficult end of easygoing. And then you're slow to warm up, which is the next one, the easy end of slow to warm up, the difficult end of slow to warm up. And then the other end is difficult, where you have easy end of difficult and the really bad end of difficult. Okay? So somewhere on there, you will be on that spectrum. Now, can that change over life? You can go up and down within that area that you're in, but a slow to warm up doesn't usually go to an easygoing. Okay? They can sometimes fake it and look easygoing, but your actually true temperament stays within there. But you will vary. If you're at the difficult end of slow to warm up, you may get used to that based on your environment, based on the nurturing, everything else, and you may become closer to that easy end of slow to warm up. Does that kind of make sense? I'll give a little more examples of those as we go through the next couple slides. So first is the easy temperament. This is the one, as you can imagine, it's nice. It's very easy. Parents like this. These are the kids that you say, okay, it's time to go to bed, and they say, okay, I'm tired, so they go in and they go to sleep. Okay, it's time to eat. Okay, I'm hungry because it's breakfast or it's lunch or it's dinner. Very nice, very simple. These kids actually have a very low risk of behavioral problems, okay, because one of the things that's around there is that they have, and these two are kind of compared, this positive approach to novelty, but that kind of goes along with that stimulation one. So if you're, if we're sitting here and all of a sudden I bump into this and this falls over and makes a big giant crash, okay, and there's a kid sitting there and the kid gets shocked and startled with it, says, okay, well that just fell over, and then he calms right back down, okay? That's their approach to novelty, that something new happened, but it's okay, we can adapt to it, it's no big deal, or they may get up and try to help put it up, okay? Whereas the other kids, with a difficult kid, they would just get freaked out, and then that would lead to something else, and they would be completely distraught and upset, whereas a slow to warm up, that would happen, and they would withdraw, and they would wait, and they'd see everybody else helping, and they'd stay real shy back, and eventually they would slowly warm up to it. So the positive approach to novelty, okay, they can get interested about things. They don't have as much of the emotional behavioral stuff because they can regulate themselves a little bit better, okay? They have a positive mood. Usually they're happy kids. They adapt to situations, regular biological rhythms. They eat and sleep like they're supposed to. Low intensity means they're pretty laid back for the most part. And then as we said to there, another good way of looking at this and thinking of these kids is that if the kid walked into a room like this, okay, if we had 3 kids walk through that door, each with these different temperaments, what would happen? An easygoing would walk in and they'd be like, well, that's a lot of people. And then they'd go and they'd sit on the front row and listen or do whatever they're supposed to do. A slow to warm up, if it was a kid who knew me, which actually my children are very similar like that. My little boy, he's a 3-year-old. Okay, he would walk in, he'd see all y'all, and he'd be like, oh, people, and he'd act a little shy at first, and then he'd start making eyes with you, and he'd come over and start playing and trying to, sit down. Or he would sit with colors and just amuse himself. Now, my little girl is 6, and she's just a sweetheart, but she's my shy one. And she would walk into a room, and she would see all of y'all, and she would grab onto my leg and hold it and hide behind me, and then would slowly peek out. And then she'd look at me, and if I'm comfortable, then she'd look out again and say, well, they're not so mean. And then she'd look at me again and say, well, Dad's still comfortable? Look out again. Okay, nobody's doing anything mean. Okay, and then she'd slowly warm up. And she would slowly then go over to her spot and be less shy. A difficult kid would walk in, and they'd be like, they're supposed to be up here, let's say, with me. They'd come in, and they'd be like, oh, cookies. And they would just walk back. Or they would, push you out of the way so that they want to sit where they want to sit. They don't care about what you're doing. Okay? So always think about if you went to a party or a big event, what would the kids do? So difficult temperament, these ones, we're going to actually do we're going to go a little backwards with this. Negative response to novelty. So like we talked about, novelty, they come into a room like this, and they're negative about that. I don't want to be here, I don't care what you say, I don't want to do this. And so they may just walk back out the room or go hide behind there or start throwing the fruit, whatever. They just start, I don't care. They have intense reactions, okay, which means they come in and they get mad. They start throwing the fruit or they do whatever. They're slow to adapt, okay, whereas the slow to warm up, they will warm up, okay? They're just slow in doing it. These ones are slow to adapt. Sometimes they don't even adapt. If they adapt, they're slow to it, but they may not. And then they've got the irregular biological rhythms. These are the ones that, I work with a lot of adopted kids, and I get a lot of parents that will say, oh, we adopted this one kid. I don't know what they'll do. I just can't get them to sleep at night. They stay up, and they say, we try to get their schedule, and we've gone through all the behavioral stuff. Some kids, they just say they don't want to be fed, they don't want this, or or they get colicky sometimes. You hear all these different things. A lot of times, that's kind of some of those irregular biological rhythms. Now, if somebody's colicky or something, does that mean that they have their difficult temperament? Not at all, okay? That's just one piece of the puzzle. Negative mood, which I mentioned a minute ago, they get angry, kind of easy about things. And this is one of the things that's really big, is that they have a high risk of behavioral problems, okay? Those are the kids that they don't adapt well to things. So if something new happens, like they're a teenager and they have a relationship breakup, they're not going to adapt well to it. And so what are they going to do? Maybe they'll start cutting on themselves. Maybe they will start throwing things. I mean, it's amazing the amount of times that I see for our new evals, punching holes in wall at house or something like that. So we get there and the parents are like, there's holes everywhere. And I said, well, are you going to fix them? The parents are like, oh, yeah, I've got to get around to it. And I was like, no, they've got to do that. So we create our behavioral contract where it's part of what you got to do. And the kid's like, well, I don't know how. They all watch the internet, so you got to work with them on some of that. Get them to learn how to do it. And so that's where you get some of these behavior problems. They get a high risk. So part of it is making the parent aware of what the kid's temperament. Then the slow to warm up, as you see right here, they have some risk, okay? So if you have somebody, remember I said the easygoing end of slow to warm up, they may not have behavior problems as much. If they're at the difficult end, they may have behavior problems. They have negative response to new stimuli, like my little girl. She comes in, she freaks out, but then what happens is she slowly warms up. Mild intensity, they get gradual adaptation after repeated contact, which is why when she's holding onto my leg, she looks at me, Dad looks okay, looks at you guys, they're not too mean, Dad looks okay, they're not too mean. And after a little bit of that repeated contact, kind of stuff like that, she'll get better. These are the kids that you may get where the parents say, they cry every morning before we go to school. I say, okay, so what's going to happen? Parents are like, oh, so I stay with them. No, you got to get your routine. And once you get the routine, repeated contact, the kids start to adapt to it. Okay, so the next thing is goodness of fit. So we have these three temperaments. Okay, you remember, you're going to put your kids into one of these three temperaments. Well, so what does it mean? What's it going to do? Well, so you've got to figure out what is the goodness of fit. How do they relate? And this is talking about an adult to child. I have parent-child, but it's adult to child, and I'll explain that part in a minute. Easy parent, easy child, no problem. Okay, difficult parent, difficult child. If you have a parent who already has disrupted rhythms and stuff like that, and then you have a baby that doesn't sleep at night, and the parent's already like, well, they can't adapt, and they can't do this, but the parent can't adapt too, and the parent gets very easily frustrated. The kid is not getting any of that attachment and nurturance from the parents, so you can imagine you can get a lot of abuse, or you can get lots of worsening behavioral problems. So that's a bad combination. Okay, easy parent and difficult child, or the other way around. If you have a difficult parent, okay, who's not super attached to the kid, not doing stuff, but you have a kid who's really laid back, the kid kind of learns to adapt and learns to then attach to other people. If you have a parent who's very, easygoing, and the kid's very difficult, the parent's like, oh, I'm tired because they were up all night, but you know what? Hey, this is what happens. We can adapt and we adjust. And then you have the slow to warm up is kind of depending on if it's a difficult parent, it makes the kid a little harder, and easier. The reason that I say this is that if you guys go through the three things before, some of you all are probably thinking, am I easygoing? Am I slow to warm up? Or am I difficult? And as you go through that, think about that, because when you work with these kids, and these kids come in, and you take a kid, and you say, I'm slow to warm up, and this kid is difficult, you're going to have a lot more frustration with that child. And you may want to say, wow, this person is probably going to either a therapist or somebody who works with them who's easygoing. Okay? And that comes from realizing that even though we're all out there sometimes on our own, there's still going to be other people out there who can help.